Welcome to LPN LaunchPad's review for medication administration, diagnosis, and planning. This review highlights how proper diagnosis aligns with patient conditions and how careful planning ensures safe medication use and improved outcomes. Diagnosis and planning matter because aligning medication choices with a patient's conditions and comorbidities enhances safety, verifying orders, and applying clinical judgment reduces adverse reactions, and thoughtful goal setting helps monitor treatment effectiveness. This session covers using assessment data to diagnose medication needs, identifying primary conditions and comorbidities, developing patient centered medication plans, and verifying orders while applying clinical judgment. The main objective of the diagnosis step is to employ assessment findings to determine patient health problems and select the most suitable medication therapies following specific treatment goals. Identifying primary conditions includes differentiating between acute issues like infections, pain, or allergic reactions, and chronic disorders such as hypertension, diabetes, or heart failure to guide drug therapy appropriately. To optimize medication selection and dosing, the nurse must consider health problems or comorbidities besides the primary illness, e.g., kidney disease complicating pain management or liver dysfunction affecting statins. Determining drug requirements involves matching the diagnosis to a specific medication category, antihypertensives for hypertension, or antibiotics for infection, while ensuring the treatment aligns with the patient's overall clinical picture. Factors influencing drug efficacy and patient tolerance include any history of allergies, prior adverse reactions, and a cost benefit evaluation that weighs potential risks against therapeutic benefits. Self care capabilities must also be evaluated, considering the patient's cognitive and physical abilities, such as managing pill bottles or performing insulin injections, and access to resources like pharmacies or financial support. NCLEX. Tip for the diagnosis phase reminds us that chronic diseases often lead to polypharmacy risks. Continual monitoring of kidney or liver function is critical with comorbidities, and cognitive impairment raises the chance of medication errors. The central goal of planning is to establish a patient centered medication plan that addresses short term aims, e.g., immediate symptom relief, and long term objectives, e.g., stable glycemic control. Goal setting should be specific, measurable, and time bound. For example, reducing blood pressure to 120/80 within 4 weeks using antihypertensives, or decreasing pain to 3 out of 10 within an hour of opioid administration, with short term and long term targets in mind. Collaboration is essential, involving the multidisciplinary team of physicians, pharmacists, dietitians, and family members or caregivers. Patient preferences and lifestyle considerations should guide dosing schedules, and cultural or religious practices should be respected. Verifying medication orders includes cross checking the right drug, dose, route, time, and patient, identifying potential interactions, such as warfarin with certain antibiotics, and performing independent verification for high risk medications like insulin or anticoagulants. Clinical judgment requires the nurse to evaluate patient specific factors such as renal function, age, or pregnancy status, and monitor for signs indicating medication adjustments, such as adverse reactions or suboptimal therapeutic effectiveness. The NCLEX tip for the planning phase emphasizes start low, go slow with older adults, ensuring a cosigner for high risk medications, and monitoring early for adverse events. NCLEX question 1. A patient with heart failure also has chronic kidney disease. Which medication might require the most caution due to potential effects on renal function? A. Acetaminophen. B. Ibuprofen. C. Omeprazole. D. Insulin. The correct answer is B. Ibuprofen. NSAIDs can exacerbate renal issues, making ibuprofen particularly concerning for those with chronic kidney disease. NCLEX. Question 2. The nurse is planning medication therapy for an older adult with hypertension, diabetes, and mild liver dysfunction. Which principle is most important when selecting a new antihypertensive? A. Start with the highest recommended dose. B. Choose a medication that does not require renal monitoring. C. Avoid adjusting the dose based on liver function tests. D. Use the lowest effective dose and titrate slowly. The correct answer is D. Use the lowest effective dose and titrate slowly. This prudent approach reduces adverse effects for older patients with multiple comorbidities. NCLEX. Question 3. A prescriber orders warfarin for a patient already on trimethoprim sulfamethoxazole. Which is the best nursing action during the planning phase? A. Administer both medications. B. Decrease the warfarin dose by half C. Verify the order with the prescriber. D. Schedule the medications at different times. The correct answer is C. Verify the order with the prescriber. The antibiotic can potentiate warfarin's anticoagulant effects, necessitating careful dose evaluation to prevent bleeding complications. Key takeaways include using diagnosis to define the most suitable medications based on primary health conditions and comorbidities, considering patient tolerance and lifestyle, setting specific goals, verifying orders carefully, and maintaining vigilance for potential interactions. Thank you for engaging with medication administration, diagnosis, and planning. Please leave any nursing school related questions in the comments, and I will respond with thorough answers. Support this channel by hitting the subscribe and like buttons. Hey there, this is Brian, the creator of LPN LaunchPad. I aim to give every student a fair review for the NCLEX for free using YouTube videos that can be watched or listened to without losing value. It may be free, but it is still valuable. If you find these reviews helpful, help me keep this project alive by hitting the like and subscribe buttons and continuing to watch my videos. Also, check out the free ChatGPT NCLEX review quizzes I have made to accompany these videos. A link is in the description or search for LPN LaunchPad in the Explore GPT box. This review has been an LPN LaunchPad production. We care for our future nurses by freely sharing knowledge.